Hello and welcome to the ProCE and Clinical Care Options Infectious Disease Podcast. I'm your host, Kim Neely. In this episode from a 3-podcast series, we explore expert insights on practical strategies for pharmacists across care settings to integrate RSV vaccinations into practice. I'm joined by Dr. Mary Bridgeman from the Ernest School of Pharmacy at Rutgers, the State University of New Jersey, and Dr. Christina Madison, founder and CEO of the Public Health Pharmacist and Clinical Pharmacist in Las Vegas, Nevada. To follow along with the accompanying slide set, please visit the link in the show notes for this episode. Now, let's get started with what Dr. Bridgeman has to say about optimizing RSV vaccine use in older adults.
Fantastic. I think we've certainly learned that there are a multitude of factors that can influence an individual's vaccination decisions and decisions regarding their health care. These factors, if we think about them, can be considered in different contexts. I certainly think that there is a societal and contextual elements that can influence one's healthcare decisions, whether or not to become immunized. Certainly the role of media and public communications, as we've learned from experience with other vaccinations, personal beliefs, accessibility to healthcare services, or trust in one's healthcare authorities, or other authorities who may advocate for vaccination. Other factors can be more individual or influenced by groups and individual or personal experiences, knowledge and awareness, quality healthcare experience that may have access to. And then we also know that there are vaccine or vaccination specific issues that I think we have to consider and have an awareness of as healthcare professionals. How a vaccine might be administered for an individual, for example, with a fear of needles, how much a vaccine might cost, or the knowledge and attitudes of healthcare professionals, just to describe a few of these elements and considerations. There is evidence that a strong recommendation from a trusted healthcare professional is a powerful motivator for addressing individuals who may be unsure of their need to become immunized. And this is a graphic that comes from a survey of older adults age 60 and above to evaluate willingness for individuals to become immunized if it were recommended by a healthcare professional. And not surprisingly, because we've seen data along this line from other types of vaccines, this was RSV specific, so I wanted to highlight it here. But 77% of respondents would either definitely or probably receive the RSV vaccine if it were recommended for them by a healthcare professional. So I think that just reminds us we have a tremendous responsibility here to consider engaging in discussion with our patients regarding RSV. In evaluating survey results from the CDC and the University of Iowa regarding top reasons for adults age 60 and older to refuse to receive an RSV vaccination, again, I'll just point out there's a multitude of reasons why individuals may refuse to receive this vaccine. The top 3 reasons, according to this survey, included, I don't know enough about RSV, and both concerns about long and short-term safety. However, that these vaccine refusal reasons are varied and really in determining how to best meet an individual's vaccine needs. A different strategy for engaging patients in their healthcare decisions may be necessary to address their specific concerns. I'll talk a little bit more about shared clinical decision-making. Our patients may be conflicted when facing important personal healthcare decisions, including in deciding whether or not to become immunized or receive a particular vaccine. Just a few pointers that I'll share as we discuss vaccine confidence. Vaccine hesitance is certainly not unique. It's not a phenomenon unique to our RSV vaccines. Coccal vaccines in adolescents, hepatitis vaccines for certain groups, even the HPV vaccine. We've got some evidence where there may be some hesitance against other vaccines according to specific recommendations. We know a multitude of healthcare professionals are engaging in vaccine-related discussions with their patients, and we are part of that cadre of individuals who may be engaging in these discussions. And sometimes it's that one professional plants the idea in a patient's mind, but that patient may need time to consider their risks, to do some more research on their own. And I think we've got an obligation to be respectful of that An individual can change their mind at any time with regards to vaccine decision-making and preferences, and we should be there to support our patients in these decisions. With regards to identifying patients to engage in shared clinical decision-making, again, the strategy here could be to discuss with all individuals who might be eligible to receive the vaccine or to respond and react to patient-initiated discussion. Some key talking points for educating older adults about RSV. There are key elements of information that I think it's important as healthcare professionals we convey in educating older adults about RSV. Specifically, I think reiterating or underscoring that older adults may be at increased risk of experiencing complications associated with RSV, as we've discussed already. Addressing treatment guidelines for managing RSV and the fact that they essentially don't exist, that treatment is really involving a symptomatic and supportive care approach, that these vaccine products exist. And there is this new advent for this season that can be indicated for individuals age 60 and older, and advocating for individuals to consult their healthcare team in determining vaccination. Again, a shared clinical decision-making, and there are a multitude of references that I would advise you to visit on the CDC website in particular. Shared clinical decision-making necessitates a team-based approach where the healthcare professional and the patient really work together to determine if RSV vaccination might be beneficial and really results in an individualized recommendation. Again, with consideration for health status, concomitant medical conditions, risk factors for severe disease, and a focus on patient preferences. And I just wanted to share that, again, another organization that I think has a phenomenal toolbox for how to really engage in these types of discussions is the Agency for Healthcare Research and Quality, or AHRQ. AHRQ offers a 5-step process for engaging patients in shared clinical decision-making to facilitate us as healthcare providers and professionals working collaboratively with the patients we serve. The elements of the framework here are encapsulated by the acronym SHARE. SHARE, or S, starts with seeking your patient's participation. H stands for help your patients to explore and compare treatment options. A incorporates assessing, talking to patients about their values, their preferences, and concerns. R for reaching a clinical decision with your patient that is mutually agreeable, or again, certainly incorporates your role as the healthcare professional in providing education and assessing your patient's understanding and agreeability to that recommendation. And then evaluating your patient's decision making. At this point, I'll pass this over again to Dr. Madison for just an additional discussion on vaccine confidence.
Absolutely. Thank you so much. And obviously, we all love it when we have what we call an activated patient. So a patient that not only wants to be there and wants to engage in their healthcare, but understands the importance of making those decisions with their healthcare professional so that they can understand what's best for them and really have that give and take so that they make sure that they feel like everyone is there and is in their corner and wants them to be the healthiest version of themselves. So kind of along those same lines with having our activated patient, we want to promote vaccine confidence. We know how important this is because we saw firsthand during COVID-19 and really towards the pandemic that people are sometimes fearful of the unknown. And obviously, this is a new vaccination. It's not an unknown version of a vaccine type. However, it is something that is novel to this age group. And so what we understood and what we learned from that is that when we embrace an attitude of empathy and collaboration, we are able to bring people to the table and allow them to have confidence in the decisions that they're making. Always making sure that we're asking permission to discuss vaccinations with the patient and not thinking that this is information that they obviously want. We would love for them to want it, but we really do need to make sure that we're asking for permission. And then responding to questions about their overall health, their mental health, as well as their vaccinations, and using motivational interviewing and interacting with the patient in order to help to engage them in the process so that they want to move forward with their vaccinations. talking a little bit about that motivational interviewing in detail, we know that this is a method of interacting with our patient that aims to explore reasons why they may be hesitant and ultimately utilize that tool in order to help change their attitudes and behaviors with an objective of moving the patient or caregiver into an optimal health-related behavior. Again, using those tools of motivational interviewing, asking for permission, making sure that we're embracing that empathy and collaboration with the patient and responding to all of their questions. And in some instances, maybe their fears around why they don't want to be vaccinated or why they specifically have hesitancy to this individual vaccine. Well, here are some strategies that we can use. We've got, first and foremost, asking open-ended questions. And with that, also making sure that we are understanding that some patients may have a language barrier, they may have a health literacy challenge. So when possible, making sure that we're providing things in writing and in language also will help with when we respond to these questions. And when possible, having someone who's bilingual also helps with providing this information. So it's a bit of a loop. So once we've asked that open-ended question, we want to reflect and respond. We want to affirm strengths and validate their concerns. We want to ask, provide, and verify. And then at the end, we want to summarize our interactions and then determine next steps and next actions. And in some instances, this next step and next action may not result in the vaccine being administered. However, we do want to make sure that we provide them with additional information and a mechanism where they can come back and ask additional questions if they feel like at that point they aren't ready to make the decision right now. That's okay. They can always come back to us at a later date. So when we think about a pharmacist's role and really optimizing the uptick, I do think that we want to be very proactive about getting these vaccinations. I always say that vaccine assessments should be part of all primary care visits. It should be incorporated into every portion of our healthcare system, because ultimately we want to make sure that everyone is being involved in the preventative care process. So when we think about proactive approaches, we can do things like running reports. We know how old people need to be in order to potentially be eligible for this vaccination. We also know what kind of healthcare conditions put people at risk for RSV disease. And so we can look at our records and see, are there people that are receiving medications that are in our pharmacies that are related to healthcare conditions that put people at higher risk? So those are things like diabetes, heart failure, heart disease, kidney or liver disease, COPD or asthma. And then once we run those reports and identified those individuals who may benefit from vaccination, we can add reminders on people's prescription bags and note why they're receiving that little note in their prescription is because of the fact that they're picking up a medication that is being used for a healthcare condition that makes them eligible to receive that vaccine. We can also use the help of our trainees. So pharmacy students, interns, residents, they can definitely help with this type of project. We can also use our MTM reviews to be able to determine vaccination assessments and what I like to call vaccine forecasting. And then for our independent pharmacies, we can offer incentives for being up to date with vaccinations and inquiring about RSV vaccine needs when patients come in for other vaccinations such as flu and COVID-19. We can do RSV vaccination and really all vaccine assessments across any area of our healthcare system. That includes our ambulatory care settings, as well as hospitals and transitions of care and long-term care facilities. For our ambulatory care settings, vaccinating in-house or sending them to a pharmacy can be an acceptable means of getting them vaccinated. I will tell you, when you are able to incorporate these services into your ambulatory care setting, you do often have a higher uptick in vaccination just because it's easy and we make it convenient for the patient by offering it in office settings like primary care clinics, cardiology offices, pulmonology offices, and endocrinology offices, especially if they're there for diabetes care. And then vaccine indications, when new diagnoses are being made. So if somebody has a new diagnosis of asthma, COPD, heart failure, diabetes, this is a great opportunity to get them up to date with vaccinations that are indicated to help prevent them from getting an infection that we can provide them for a vaccination for. And then community pharmacy partnerships. I'm wanting to see more of this because I don't think that we see enough partnerships with our community pharmacies where we can really just look to see what type of primary care offices, physicians' offices, prescriber offices are within just a 5 to 10 mile radius. Again, it's all about making this as easy as possible for the patient. And so if it's somewhere that's convenient for them, why not create an incentive or a referral system so that you can get people to come into your pharmacies? And then ultimately, you can do this with hospital systems as well. So referrals from hospitals, post-discharge, partnering with your local hospital systems, and then vaccination recommendations added to discharge paperwork so that people understand, why they should be vaccinated in order to prevent rehospitalization due to respiratory illnesses. So something I slightly alluded to earlier was around pricing and insurance. So private insurances, this is a preventative care benefit. So under ACA or the Affordable Care Act, all vaccinations should be covered at a $0 copay for patients with private insurance. Now, the challenge is once somebody is on Medicare, then things get a little bit tricky. So our Medicare benefit and then our provisions under the Inflation Reduction Act allow for routine recommended vaccinations to be covered at full price. However, because this is under shared clinical decision-making, there is the potential that Medicare or your Medicare Advantage program, once you're 65 and older, may cause you to have to go through a few more hoops in order to get this vaccination covered. As we mentioned before, ACIP routine recommended vaccinations are in yellow, and these are fully covered by commercial insurance, Medicaid, Medicare, under the Inflation Reduction Act. And this is because it is considered to be preventative care. It's a USPSTF grade A recommendation and should be free. Now, with RSV vaccine being under shared clinical decision-making, which is blue, insurances could deny coverage or require proof of need. Just with that being said, just making sure that this is on your radar. If it's not covered initially, these are some things that you can do to help the coverage in the future. So gaps in coverage may be between the ages of 60 to 64. And again, the coverage under the Inflation Reduction Act starts at age 65. Under the Inflation Reduction Act, which was passed last year, it allows for financial relief for Medicare recipients, and it improves affordability and expands benefits by lowering drug costs, as well as stabilizing premiums and capping the amount of out-of-pocket costs that our seniors have to pay for their medications or preventative care. And then mandatory Medicaid coverage for ACIP recommended adult vaccinations is a provision without cost sharing. So that means if it is routine and recommended, it is a mandatory Medicaid coverage. And then under Medicare, this is going to be starting no later than October 1st. Full vaccine coverage may be denied for individuals age 60 to 64 who are not eligible for Medicare yet. And then ACIP recommended vaccines may not be covered for those recommended via shared clinical decision-making. I have not heard of anyone being denied at this point. However, I do want to make sure that individuals understand that this may require just additional information in order to get it covered.
I'd like to thank Drs. Bridgeman and Madison for that excellent discussion, and thank you to our listeners for joining in. As a reminder, to view the slideshow for this podcast and to access the full program on frontiers in RSV prevention for older adults, developments, recommendations, and the pharmacist's role, click on the links in the show notes for this episode. And please be sure to check back regularly for more episodes on important infectious disease topics. Thank you.